Hi, thank you for viewing my presentation on dementia. My name is Cynthia Summers. I'm a graduate nursing student at Aurora University, and this lecture presentation is for nursing class 6180, Theoretical Foundations of Nursing Education, for my professor Sandra Hughes, PhD, RN, CNE. The objectives for this lecture presentation, after reviewing, you, the listener, reader, will be able to 1. Identify the types of dementia, 2. List risk factors, both modifiable and non-modifiable, 3. Distinguish between the different stages of dementia, and 4. Identify pharmacological and non-pharmacological management. Dementia is a process of memory loss caused by damage to brain cells, ultimately impacting an individual's quality of life. This presentation examines the prevalence of dementia, classification, and the different stages of dementia. The causes and risk factors associated with dementia, examining both modifiable and non-modifiable risk factors. Diagnostic testing and exploring treatment plans with the utilization of both pharmacological and non-pharmacological management. Dementia begins with lapses in memory and progresses to severe impairment with the inability to communicate. It is progressive and worsens over time. Dementia is not a specific disease, but according to dementia.org, it is a term used to describe a decline in memory or brain function that impacts an individual's daily life. Dementia is caused by damage to brain cells. This damage interferes with the cell's ability to transmit information, leading to a decline in cognitive function. The National Institute of Neurological Disorders and Strokes, NIH, 2015. By the way, at the end of this presentation, there is a reference page of all cited works. So the NIH reports that a patient must have at least 2 impaired mental functions. These functions include memory, language skills, visual perception, and the ability to focus and pay attention. These also include cognitive skills, such as the ability to reason and solve problems. The loss of brain function is severe enough that the person cannot do normal everyday tasks. There are several different types of dementia. Dementia can be classified in a variety of ways and are often grouped by what they have in common, such as what part of the brain is affected or whether they worsen over time, progressive dementias. And this information is provided by the Mayo Clinic. The different types of dementia are Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Other disorders linked to dementia are Huntington's disease, traumatic brain injury, Creutzfeldt-Jakob disease, and Parkinson's. There are both modifiable and non-modifiable risk factors associated with dementia. according to ATIS medical writers, the strongest risk factor for the development of dementia is age. Wally Breitner Wright, at about 50 years of age, the brain begins to shrink from an average weight of 1.3 kilograms to about 1.2 kilograms by 65 years of age. Contrary to the widespread belief, this shrinkage does not reflect a generalized loss of nerve cells. It results from loss of water and reductions in the normal complement of brain cells in a few specific areas of the brain, selective neuronal loss. This type of selective loss of brain substance is nearly universal in aging, but atrophy is much more striking in the presence of age-related neurodegenerative diseases. Patients obviously cannot modify this risk factor, but there are several other risk factors that are modifiable. Modifiable risk factors include elevated cholesterol levels, excessive alcohol use, hypertension or high blood pressure, obesity, diabetes, high estrogen levels, homocysteine blood levels, and smoking, according to the Mayo Clinic. All right, time for our first knowledge check. True or false? Dementia is classified in a variety of ways and are often grouped together by what they have in common. This is true. What are the different types of dementia? A. Lewy body. B. Alzheimer's disease. C. Vascular. D. Frontotemporal. E. Traumatic brain injury. F. All of the above. Or G. Only A, B, C, and D are correct. Give you a second to think about that. What are the different types of dementia? A. Lewy body. B. Alzheimer's disease. C. Vascular. D. Frontotemporal. E. Traumatic brain injury. Or F. All of the above. Or G. Only A, B, C, and D. If you selected the last one, G, you are correct. The different types of dementia are Lewy body, Alzheimer's disease, vascular, and frontotemporal. Now let's discuss the stages of dementia. There are 7 stages. Stages 1 through 3 are generally referred to as the pre-dementia stage. In stage 1, there is no cognitive decline. This is the normal functioning stage in which the patient typically does not display any significant problems with cognitive impairment or memory loss. Stage 2 is the age-associated memory impairment stage, where there are occasional lapses in memory. Things like remembering where items are placed. I think we're pretty much probably all at that stage. Where did I put my keys? Where did I park? Did I remember to turn off the coffee pot? Signs of the disease are nearly undetectable through clinical testing, as the memory loss of age is associated. Stage 3 is mild cognitive impairment. Cognitive problems are apparent as the patient gets lost easily, forgets names of family members and close friends, difficulty retaining information read, and difficulty concentrating. Patients often start to experience mild to moderate anxiety, and these symptoms increasingly interfere with day-to-day life, according to Dementia.org. Stage 4 is mild dementia. In this stage, patients become more socially withdrawn as memory losses begins to worsen and personality and mood changes are noticeable. They begin to delay or develop defensive mechanisms to cover up symptoms. They become more disoriented, have difficulty recognizing people they know, have difficulty recalling their own personal history, and have a decreased ability to manage personal finances. Stage 5 is moderate dementia. In this stage, they need assistance in carrying out activities of daily living and have difficulty remembering close family members' names or addresses. It interferes with basic activities and require assistance. They do not need assistance with feeding or toileting at this point and will remember who they are. Stage 6 is the moderately severe dementia stage. Patients forget names of their children, their spouse, and are unaware of their surroundings. They may wander off and have delusional or obsessive behaviors and an increase in anxiety and agitation. The last stage is stage 7. It is severe dementia with the loss of motor skill, and progressively they lose their ability to speak. Dementia.org states in the final stage, the brain seems to lose all its concentration with the body. Severe dementia frequently entails the loss of verbal and speech abilities. All right, that's time for another knowledge check. Modifiable risk factors associated with dementia. They include A, smoking, B, high blood pressure or hypertension, C, age, D, obesity, and E, diabetes. If you listed A, B, D, and E, you are correct. All but age are modifiable risk factors. As we know, age is a non-modifiable risk factor. Continuing with another knowledge check. True or false? There are 5 stages of dementia. If you guessed false, you are correct. There are 7 stages of dementia. Another true and false. Stage 1 is referred to as the pre-dementia stage. You remember learning about pre-dementia. Stage 1 is referred to as the pre-dementia stage. True or false? If you said false, you are correct. Stage 1, 2, and 3 are all considered the pre-dementia stage. So remember, if you're forgetting where you parked, pre-dementia stage. Diagnosis. A diagnosis of dementia can be achieved through a detailed history of presenting complaints, such as a cognitive, behavioral, or psychological symptoms, a mental state examination to exclude psychiatric comorbidities and identify any anxiety, depressive, or psychosis symptoms. A physical examination also must be completed to rule out disorders that may mimic dementia, like hypothyroidism and Parkinson's disease, and cognitive impairment like depression and delirium. A basic cognitive testing must be performed to assess orientation, both long and short-term memory deficits, language, attention and concentration efforts, and executive functions. Neuropsychological examinations should be conducted by a specialist to confirm deficits. It's Adidas Medical Writers, 2014. Neuroimaging can be completed to eliminate cerebral pathological dysfunctions and to determine the types of dementia, whether it be vascular or another form. The National Institute of Neurological Disorders and Stroke, NINDS, explained that brain scans can identify cerebral vascular accidents, tumors, or other problems, and can identify changes in structure and function. These scans include computed tomography, or CT scans, magnetic resonance imaging, also known as MRI, or positron emission tomography, also known as PET scans. Due to cell loss associated with dementia, a PET scan shows a decrease in neurotransmitters during brain activity, while the patient performing mental functions such as reading, hearing, speaking, and thinking about words, according to the Alzheimer's Association. Laboratory blood tests and other means of helping to rule out other conditions like electrolyte imbalances, a complete blood count and urine analysis to rule out infection, blood sugar tests to rule out hypoglycemia, B12 levels, thyroid function, and cerebral spinal fluid analysis, NINDS. Once other conditions have been eliminated and dementia has been confirmed, the next course of action is a treatment plan. Since there are varying stages and types of dementia, the management will be dependent on the diagnosis. There are currently no treatments available to reverse the disease process, but there is medication that is commonly prescribed for the treatment of patients' cognitive symptoms. The American Academy of Neurology report treatment guidelines for the management of dementia state that cholinesterase inhibitors offer a small benefit for individuals with dementia, noting that vitamin E may aid in delaying the time to clinical progression. Data on selegiline, other antioxidants, anti-inflammatories, and estrogen are not sufficient and thus are not recommended. The use of antipsychotic medications may be useful in managing agitation, or psychosis in individuals with dementia who have not responded adequately to environmental manipulation, which we will discuss in non-pharmacological interventions. The use of antidepressants has also been shown to be beneficial as a treatment therapy for depressed individuals with dementia. NINDS also reported most drugs for dementia are used to treat symptoms in Alzheimer's disease. They also conclude that cholinesterase inhibitors can temporarily, as medication cannot prevent or cure dementia, improve or stabilize memory and thinking skills in some people by increasing cholinergic activity. Memantine is another class of medications, a NMDA receptor agonist, which may prevent a decline in memory and learning abilities. NINDS concludes that NMDA receptor agonists work by regulating the activity of the neurotransmitter glutamate. When glutamate activity levels are excessive, neurons may die. Memantine may be combined with cholinesterase inhibitors for added benefits. A recent comprehensive review of pharmacological interventions for dementia patients found that pharmacological therapies are not particularly effective for management of neuropsychiatric symptoms of dementia, according to Gallagher-Thompson. As the progression of symptoms occur, psychosis is common, and the patient may be prescribed antipsychotic medications. Although antipsychotic medications can be effective, its use should be confined to those patients who experience true psychotic symptoms, examples hallucinations and paranoid delusions, that are distressing and pose a risk to the patient and others, ADIS medical writers. It should be noted that the lowest dose of antipsychotics be prescribed for only a short period of time with frequent review of medication necessity and discontinuation of its use unless its benefits are evident. Studies over the past decade have demonstrated that antipsychotic medications have limited efficacy when used for this purpose, and there is also an increased risk of death in elderly patients who receive antipsychotic medications. McConnell. In addition to pharmacological approaches, there are benefits to non-pharmacological approaches to treat dementia. Likely, one of the most key management challenges is supporting the patient and their families. There have been concerns that when a patient has mild cognitive impairment, they do not receive support services and are instructed to return when symptoms worsen. Samsi Mantharup report the use of psychosocial interventions to alleviate some of the symptoms of dementia has grown in popularity in recent years as new and innovative therapeutic approaches are trialed, including cognitive stimulation therapy and reminiscence therapy, among others. Research conducted by Gallagher and Thompson et al. Suggests successful interventions for dementia include individual and family counseling, psychoeducational programs teaching caregivers coping skills, specialized skill training on behavioral management, and psychotherapy cognitive behaviors. There is also so many interventions that nurses can do to address dementia. As the disease progresses, it is important for us to allow the patient to do as much as they can for themselves. I know it's easy to get caught up in tasks and we have things that we need to do, so it would just be much faster if we put their shirt on for them, even though they are capable of putting their shirt on for themselves. We must encourage and have patience and take the time to let them do as much for themselves as they can. It is also important that behaviors associated with dementia be addressed using a humanistic approach and understanding that negative behaviors are often a form of communicating an unmet need and cannot be verbally expressed due to the disease process. Written by Sarf 2010. So we must figure out what it is that they need. Although pharmacological treatments may have beneficial effects in some patients with dementia, it is imperative caregivers truly use as needed medications when non-pharmacological interventions have been attempted first. All right, another knowledge check. Diagnosis of dementia is achieved through multiple choice. A physical examination. B, a detailed history, physical examination, cognitive testing, neuropsychological examination, imaging, and blood work. C, brain biopsy. Or D, spinal tap. If you chose the letter B, you are correct. Diagnosis of dementia is achieved through a detailed history looking at chief complaints, physical examination, cognitive testing, neuropsychological examination, imaging, and blood work. A true or false? The use of antipsychotic medications should be used with caution. Is that a true statement or is that a false statement? And I'm sure you said true. The lowest dose of antipsychotic medication should be prescribed for only a short period of time with frequent review of the medication necessity and discontinuation of it unless its benefits are evident. All right. Non-pharmacological interventions include multiple choice. There are multiple correct answers. Non-pharmacological interventions include A, support, B, psychosocial interventions, C, counseling, D, psychoeducational programs, E, independence promotion, or F, humanistic approaches. And you said A, B, C, D, E, and F are all true. All of them are non-pharmacological interventions. So that concludes the lecture presentation on dementia. As you have learned, dementia is categorized by the part of the brain affected and includes Alzheimer's disease, vascular dementia, Lewy body, and frontotemporal dementia. There are both non-modifiable and modifiable risk factors. There are 7 stages of dementia. They include no cognitive decline, age-associated memory impairment, that's we all lose our keys, mild cognitive impairment, mild dementia, moderate dementia, moderately severe, and lastly, severe dementia. And I'll say that again. The 7 stages include no cognitive decline, age-associated memory impairment, mild cognitive impairment, mild dementia, moderately severe dementia, and lastly, severe dementia. Regardless of the stage, type, or cause of dementia, there are beneficial management, which include pharmacological and non-pharmacological efforts. The effects of dementia undoubtedly have challenges that require supporting the patient through each phase, and additionally require supporting the patient's families. I have included a list of references here that have been used for the purpose of this lecture presentation. And I appreciate you taking the time to listen and learn a little bit more about dementia.